Thank you for joining us for our last session of day 3 entitled Integrating Exercise into Life with Kidney Disease. My name is Joy Hall, and I am the Director of Outreach and Strategic Partnership for American Kidney Fund, and also your moderator for this session. During this hour, we will discuss the impact that exercise has on health outcomes for someone living with kidney disease. The panelists will also discuss challenges associated with exercise and share tips on integrating physical activity into your life. I would like to begin by introducing you to today's panelists, starting with Dr. Anup Shashadri. Dr. Anup Shashadri is a geriatric nephrologist who cares for patients with chronic and end-stage kidney disease. He earned his medical degree from the University of Texas Southwestern Medical School. He completed his residency at the UTSW Medical Center in Dallas with an AKF Clinical Scientist in Nephrology Fellow and was an AKF Clinical Scientist in Nephrology Fellow, and completed his fellowship in nephrology and a master's degree in clinical research at the University of California, San Francisco. He is now an assistant professor at the Division of Nephrology at UCSF and the nephrology section at the San Francisco VA Medical Center. Dr. Shashadri overall focus is on improving outcomes and care for older patients with chronic kidney disease. He strives to help his patients find medical and lifestyle interventions that improve their symptoms, quality of life, and cardiovascular outcomes. In his research, Dr. Shashadri studies the effects of physical activity and exercise for patients who are being treated with dialysis, as well as ways to improve the ability of patients to engage in exercise. He specifically is interested in improving care for older adults on dialysis, as they are especially vulnerable to adverse health outcomes and therefore require more specialized multidisciplinary approach than younger adults. To that end, his research also includes how to reduce the caregiving burden for caregivers of such patients. His current research has a focus on prehabilitation prior to kidney transplant in older patients awaiting kidney transplantation and their caregivers. Next, we have Bonnie Cam. Bonnie was diagnosed with chronic kidney disease in 2012 and was then told she was in kidney failure 6 years ago from now. Once she started peritoneal dialysis in July of 2020, she started experiencing challenges within maintaining an active lifestyle due to increased fatigue. In February 2022, Bonnie was contacted to participate in Dr. Shashadri's research to study the role exercise has on patients after transplant. She received her transplant in April 2022. Today, Bonnie is looking forward to sharing the impact exercise played on her health outcomes followed by her transplant. Before we get started, I want to encourage everyone to please type your questions and comments into the chat box. We will try our best to get to your question during the Q&A segment at the end of our talk today. I would like to now turn it over to Dr. Shashadri to provide an overview of health outcomes associated with exercise for kidney disease patients and the research in this area. Dr. Shashadri?
Thank you so much for that lovely introduction. I should start by saying, I have a few disclosures just in terms of my funding. I'm funded by UCSF to look at remote measurement of physical performance for patients treated with dialysis, and the National Institute on Aging to identify goals and barriers to prehabilitation in adults treated with dialysis waiting for transplant, and NCATS for a structured program of exercise, the one that Bonnie was so kind to help us with. So if you can't tell by this talk, I am biased towards physical activity and exercise being a good thing, and I'm happy to be in this research space. And on the next slide, you'll see some of the overview of what we're going to talk about. So I want to kind of talk about what are the differences between physical activity and exercise, because a lot of times those terms are used interchangeably, and there's overlap, but it's not necessarily the same thing. Why exercise in general, how exercise helps people both with and without kidney disease, some of the evidence on physical activity and exercise in sort of the general population, folks who don't have any kidney disease. Um, and a real take home point about there being no amount of physical activity or exercise that's so small that you're not going to receive some benefit. And then we'll get into some of the details on what prior exercise interventions we've done or have been done by others in end-stage kidney disease, some of the barriers and facilitators, and sort of how to overcome them. So on the next slide, we'll just have some quick definitions here, just to refer to later in the talk. So physical activity is technically any body movement produced by your skeletal muscles that burns calories. This could be walking, this could be gardening. A lot of my physical activities, chasing after a toddler and 10-month-old. So whatever you're doing that's burning energy is physical activity. Exercise is sort of within the overall category of physical activity. It's planned, it's structured, it's repetitive, and it has a focus. And that focus is either on improving or maintaining one or more components of physical fitness. And on this next slide, you'll sort of see a diagram. And you don't have to, look at this necessarily in detail, but the general idea behind this is that exercise both is your ability to exercise is both affected by other things going on in your life. So in this case, we're focusing on chronic kidney disease, aging, because chronic kidney disease is sort of this disease of premature aging in a way. That is, patients who have chronic kidney disease, it affects your body in a way that sort of accelerates the natural aging process in a way. Um, and that can be partly, with dialysis itself. Dialysis can certainly cause that in terms of fatigue and other symptoms and some direct effects on your body, but also that when you have these other things to deal with, it becomes harder to exercise. And so it promotes sedentary behavior. And you can kind of get into this feedback cycle a little bit. But thankfully, exercise also acts to arrest those cycles. So exercise can interrupt the sort of loss of fitness that can come as people progress through kidney disease. It can help you regain muscle mass. It can help you improve your physical performance. And really, at the end of the day, it can help you improve your ability to do the kind of things that you want to do, which, broadly speaking, I think is sort of or should be sort of one of our big goals in medicine. Like, how can we help people actually do what they want to be doing with their lives, as opposed to we also do a lot of tweaking numbers. Numbers are important. Any nephrologist will tell you that. But uh, I think to a lot of people, it's about what can you do at the end of the day, right? And exercise can also help with, bone health. It can help reduce inflammation, and it can help you not only stay alive for longer, but stay alive in a way that actually feels like you're living. So the next slide, we're going to kind of go over this schematic real quick, and this is something that I actually don't remember if we showed Bonnie this when we did our research, but this is sort of the conceptual schema for exercise prior to transplant. So the idea is that when you're treated with dialysis, and folks who are on the wait list will kind of know, the wait list can seem like a long time. And while you're on the wait list, it can kind of seem like your physical function is getting worse. And truly, for some patients, that might be the case. An exercise intervention, I'll say after transplant, physical function does eventually improve. But there's that transplant recovery period. And I think one thing that we as nephrologists don't necessarily do a good job of is telling people, hey, after that recovery period, like things won't immediately get better. It takes a while for things to get better. And it could take sort of months to years to get back to sort of where you were before. The idea behind prehabilitation is that not only can you improve physical function prior to transplant, but hopefully not just reduce that surgical recovery time, but ultimately improve your quality of life overall. So that's sort of the idea behind that. And I put this slide on there in part to show that there is no point within sort of the spectrum of kidney disease that exercise doesn't help. And you'll see that in these next slides as well. So this is in a study in chronic kidney disease. So these are people who were not on dialysis, contrary to the prior slide. And it's an exercise study that happened back in 2012, 2013 called the LIFE study, lifestyle interventions for fitness in elders. So these were patients aged 70 to 89 years of age who are randomized either to a moderate intensity activity and exercise arm or sort of usual health education, basically. And over the course of 2 years, the patients who were in the exercise arm actually had less decline in kidney function over that course of time. So, and this is independent of changes in blood pressure, which we know affects kidney function. This is independent of changes in weight. So exercise by itself exerted sort of a beneficial effect on the kidneys, reducing progression of kidney disease. And this is really cool for a number of reasons because a lot of the things we do to slow kidney decline right now are, pharmacological. There's medications that can certainly help, but one, medications have side effects, and two, a lot of patients are already on these medications. So this is something in addition that people can do. And as we sort of said before, exercise and activity have non-kidney benefits as well. And one other cool thing about this was that we have this sort of magical number, 10,000 steps per day, that we think of in terms of that's the number of steps that we put as a goal, and it's a good goal. I'm not saying it's a bad goal. But the people in this study, only about 1 in every 12 walked more than 5,000 steps per day, and about the people who walked more had the strongest benefit. But again, most of those were sort of in this 3,000, 4,000 step kind of range, what we call our sort of highest quartile of activity. So this is to say that you don't necessarily. It's not that walking more isn't better, but you don't necessarily need to reach those peaks of activity in order to benefit your kidneys. Um, and on the next couple slides, we'll talk a little bit about the steps per day. So briefly, less than 5,000 steps per day is sort of considered sedentary. 5,000 to 7,500 sort of low active, 7,500 to 10,000 somewhat active, and active starts at this 10,000. And on the next slide, I just want to kind of like highlight this less than 5,000 steps because that is where the majority of patients, certainly with end-stage kidney disease, and many patients with chronic kidney disease before dialysis, are sort of in that group. On this next slide, we're going to talk about, well, actually, if we can go one more slide, there's a lot of guidelines for activity and exercise, but these are sort of what it boils down to, right? And I encourage you to read the U.S. Department of Health and Human Services and the American Heart Association and, the sport medicine recommendations. They go into detail on this, but ultimately what we're aiming for is 150 minutes of moderate intensity physical activity per week, and ideally 2 or 3 exercise or muscle strengthening sessions, per week also. So what is moderate intensity, right? On the next slide, there's a little bit hard to read this diagram, perhaps, but basically everything above this line is sort of considered moderate intensity activity. And again, it doesn't necessarily meet the definition of exercise unless you're doing it for exercise. But things that sort of arise there in terms of daily life are childcare is probably a good one for that people with children can sometimes have to do. Gardening is something that actually rises to the level of moderate intensity physical activity. But you'll notice that walking is actually a pretty solid moderate intensity activity. And to be honest, that is the primary exercise energy expenditure of most patients with kidney disease and end-stage kidney disease. And it's for a good reason. It's that walking does have a lot of beneficial effects, and also walking is relatively, it's not easy to do for everybody, but you don't need any special equipment necessarily in order to do it. On this next slide, we're going to go into one important take-home point here, which is that no increase in activity is too low. So this, I'll just say this graph is looking at patients treated with dialysis in these activity ranges. And, these are already people who are walking less than 2,500 steps per day. And it just goes to show that even if you're increasing from 2,000 to 2,500 or 1,500 to 2,000 steps per day, over the course of time, that has a real benefit in terms of not just how you feel and symptoms and what you're able to do sort of qualitatively, but actually mortality. That is, walking more, or being able to walk more at least, is associated with survival. Can we go to the next slide, please? And it's easy enough for me to say, okay, walk more. And I think the problem is a lot of times doctors sort of leave it at that. You need to walk more. But to be honest, if you don't have sort of like a focused plan and some help kind of doing it, it can be very difficult to do so. So this is an intervention we did for patients treated with dialysis called the Pedometers and Exercise in Dialysis Study. It was about 60 patients treated with dialysis. And I just showed a sample progression for one patient that we did. This basically, we asked people to increase their step counts by about 10% each week. And so that sort of light blue line is sort of our projection of our actual goal. The dark blue line is what the patient actually did, and yellow is the goals as we kind of set. And you can see that sort of we updated the goals kind of periodically to reflect kind of where they were. And I'm showing a little bit of an idealized graph. But the idea is that, this patient was able to, over the course of 12 weeks or 3 months or so, go from about 2,500 steps per day to almost more than doubling their step count by the end of 3 months, just with a focused plan and admittedly a lot of guidance and weekly check-ins. Like there was a lot of work from both ends, but it's doable. Is the important thing, and I think that that's important to acknowledge because for a lot of patients it can seem insurmountable. And I think because of that, a lot of providers don't necessarily do a good job of delivering this type of encouragement. On the next slide, you'll see a sample of a resistance exercise intervention. So this graph basically shows improvement in work generated after a program of leg exercise. And again, this is 3 sessions per week of leg exercise. And I'll say that the gains are limited to the muscles work. If you work out your legs will get stronger. If you work out your arms will get stronger. But again, for even if you're a patient treated with dialysis and you have hemodialysis and sort of all the intense disruption to your lifestyle that can sometimes be for patients, it is possible with these programs to kind of improve. And these two were both programs that had a fair amount of provider input into feedback and checking up on goals and things like that. But I will say that newer studies, including our own study, have really sort of shifted or trying to shift to this home-based approach. The idea that you don't necessarily need to have to come into the hospital or to a clinic or to physical therapy to do this, that with the proper guidance and training, you are able to do these kind of things at home. And there are challenges to overcome for that as well. But ultimately, and I'll mention this again later, the exercise intervention that is best for you is the one that you have fun with and that you are going to be able to do. Next slide, please. So we did interviews of I want to say about 48, 24 patients and 24 caregivers of patients who were treated with dialysis to figure out what were the barriers people had to exercise with this. I'm not going to say a novel idea, but we wanted to make sure before we embarked on this program of exercise that we talked to the people who were going to be exercising to figure out what could we do to help before we just started sort of giving recommendations. And so one of the biggest barriers to start with was there's sort of a lack of information on appropriate exercise regimens. That is, we as physicians and sort of dialysis staff and transplant staff and things like that, we're not necessarily doing a good job on telling people what they could do and what they should be doing. There was difficulty sort of remembering to exercise and sort of incorporating it into the routine. Certainly, as people progressed through kidney disease, there was symptoms related to kidney disease or otherwise that made exercise difficult. Dialysis schedule. COVID in the last few years has been a big issue with gyms and things being closed. And a big thing that we encountered was, many patients treated with dialysis require caregivers in some capacity. And we were not initially talking to caregivers, which is a major missed opportunity, I think. As we spoke more to patients and their caregivers, we sort of understood that caregivers were not just sort of a potent resource to help their patients exercise. We would just talk to them and involve them and sort of tell them what they could do to help, sort of help us help their patient. But also, I'll say there was an acknowledgement that we were not recognizing the burden that that dialysis and things like that put not just on the patient but on the caregiver. And so that's something that we're working on right now. How can we sort of like help reduce caregiver burden, both to help the caregiver as well as to help the patient, and solutions that we sort of co-developed with these folks as we interviewed them in focus groups were certainly to get more counseling from not only physicians but also physical therapists. Jessica Aaliyah is our excellent physical therapist that works in our rehabilitation program. And I have to say that without her guidance and sort of advice and constant counseling, we wouldn't be able to do what we do right now. Weekly check-ins, from like dedicated clinical research coordinators. Shout out to my research coordinator, Gabe Garcia. Having these weekly check-ins really sort of enforce that having somebody check in and be like, how much did you walk, how much did you exercise, that's very helpful to kind of do because it sort of has that external accountability. Having a slow and steady approach to exercise. Again, the idea is not to over fatigue or overtrain, but to sort of make incremental progress. Some weeks are going to be better than others. It doesn't have to be always on the way up. Home-based exercise helps you work around your, dialysis schedule, and you don't have to worry as much about concerns from COVID and things. It can also help surmount environmental or neighborhood-related barriers. I live in San Francisco, and one big thing that we hear is I'd love to walk, but I have a 45-degree angle right outside on my street, and so sometimes you can either surmount that by going at home, or we work with caregivers to try to help people to get to somewhere where they can walk safely. And then really understanding what are the motivators to exercise. It's not just about barriers. It's about if you understand the motivators, like what patients actually want out of exercise, you can really help them tailor exercise programs to do something that they enjoy and are able to engage with. And on this next slide, uh, you know, I want to talk about some of the ways to sort of incorporate exercise into people's daily lives. And so, one big point is before you start any kind of exercise program, uh, talk to your doctor, and ideally your nephrologist, but also your primary care doctor, and just ask and see, are there any issues specific to you? Because the idea is that exercise is good for everybody, but it's individualized and tailored exercise that we're really trying to do. And so I'm going to focus a little bit on end stage kidney disease for this latter part of the talk because oftentimes that's where many of the barriers come from with hemodialysis or peritoneal dialysis or things like that. So, for example, ask how much weight is okay for you to lift. If you have a fistula surgery recently, perhaps you were not able to lift weight right away. But one thing we encountered is that a lot of times patients were going by the last guidelines they were given for weight, which is after the surgery. Whereas later on in life, after a fistula is mature and ready to use, those same weight restrictions may not apply, right? And so that's something that I've had personal experience with patients who have actually given up some of their exercise at the gym or bowling or things like that, where they perhaps didn't have to. It's just that that's the last interaction they had where someone talked to them about weight. Um, if there is an activity you like, again, I bring up bowling because that was a specific example for one of my patients who was active in a bowling league and stopped bowling after the fistula surgery. And ultimately was able to sort of resume once we were like, oh, that's okay. Thank you for bringing that up. If there's an activity you like or an exercise you like and have concerns about, please bring it up. It's good for people to know about it. And if there's any specific issues that impede exercise for you, physical therapy is potentially a good option. And it often is. I actually can't think of a scenario in which physical therapy is perhaps, not at least a good avenue to explore. There are a lot of things that physical therapy can help with, and there may be other issues that you catch. So I think it's reasonable to at least ask your doctors about that. And on this next slide, we're going to go a little further into detail here. So again, we talked about overtraining being an issue. Start slow. Even if you're only walking 5 minutes at a time, that's better than walking zero, right? Build up to 20 or 30 minutes 3 times a week, and then ultimately you can get to that 150 minutes of moderate intensity exercise, which again would be 30 minutes for 5 days. For muscle training, start with body weight exercises before adding weights or resistance bands, and be sure that you're able to exercise, do the exercise, the motions with proper execution without loss of form, without fatigue, without pain before you start going up on stuff. Sometimes there is sort of this uh, enthusiasm at the beginning, which is laudable. It's good to be enthusiastic, but you start doing exercise and like this feels really good. I'm glad to be able to do what I'm doing, but it's easy right now. Let me ramp it up. But just be cautious about doing that. Ramp it up, yes, but do so in a way that doesn't overtire you. We're talking about long-term goals and long-term progression here. So even if you're doing the same exercises for like a week or two, getting used to them, that's fine. See how that feels before ramping it up further. Do 15 to make sure you're able to do 15 to 20 repetitions of an exercise. If it feels easy, less than a subjective sort of 5 out of 10 in difficulty, then consider adding weights. But the goal is still to be able to do 12 repetitions, not to go from doing it well to not being able to do it all. Next slide, please. So the ideal program is a structured exercise program that you enjoy and you're going to engage with, can be done with good form and without adverse symptoms. It would be very nice if it's personalized for you and allows for becoming sort of part of a routine. Can you do it at the same time, same place each week? And ideally, you're going to have someone able to check in on you, deliver constructive feedback, and track results. And it's not to say that you can't do these things at home. I mean, there are ways to. You can keep your exercise logs, you can have a Fitbit, and things like that. But if I had my druthers, every patient in every stage of kidney disease would have, not just like a health coach, but a physical therapist or someone working with them to help with these kind of things. Because that backup really, really helps. And there may be resources out there. that you are able to engage with, either with your health system or outside of the health system. So if you're somebody, for example, who has a caregiver, a partner, a spouse, or something, talk to them as well. Next slide, please. My key takeaways here: exercise has a multitude of beneficial effects on the body at any stage of kidney disease. It can really arrest some of the detrimental effects of kidney disease. The goal overall is 150 minutes of moderate intensity physical activity and 2 to 3 strength exercises per week, but there's no amount of activity or exercise so small that they don't have an effect. Each person has their own barriers, but barriers can be overcome by leveraging what are the motivators that help you? What's going on in your life that can help you exercise? And thinking about these barriers and facilitators and talking to your physicians. And I admit we're not always good at this, about making time for doing this. So I think saying, "Hey, I would like to talk about exercise and activity in my life," I think most physicians would actually be very happy to have that discussion. It's just not one that we unfortunately don't initiate it often enough. I don't think. And the best activities or exercises are ones that you enjoy and will engage with. So with that, if we could move on to the next slide, please. I'd just like to acknowledge, one, the Department of Nephrology, where I'm at UCSF and San Francisco VA. I give a quick shout out from earlier, but I'd really like to thank my team for our studies, Structured Program of Exercise for Recipients of Kidney Transplantation, or SPARKed, Gabriel Garcia, Jessica Leah, my mentors, Jennifer Lai, Rebecca Sidori, and Deborah Ady. And I'd like to actually also thank AKF for giving me the opportunity to talk about something that I'm very, very happy to talk anybody's ear off at almost any time of day, because I love doing this stuff, and I think it's important, and I hope that this was helpful for everybody listening.
Wonderful. Thank you so much, Dr. Shashadri. If you all are just joining us, welcome to our session on integrating exercise into life with kidney disease. As a reminder, we are taking questions. You do not have to hold on to them till the end. Go ahead and drop those questions into the chat box, and we'll be sure to get to those, as many as possible, during our Q&A period of today's session. So Dr. Shashadri, you shared a lot of great information with us, especially about, integrating exercise into, if you're living with kidney disease. You talked about walking. You talked about doing something that's fun. I really wanted to ask the question this is from one of our audience members as well. Is there too much exercise? Or what types of exercises do you advise people avoiding when they're living with kidney disease? So any thoughts on those two?
Yeah. So, is there too much exercise? I mean, I'd say technically yes, right? So if you're exercising to the point where you are sort of over fatigued or overtired, or if you're exercising to the point where you feel like you're unable to sort of do these other activities of daily life and things like that, then arguably it may have either been an issue. Well, there's a couple of issues. It could have been too long of an exercise to start off with. The exercise itself could have been, perhaps the form was not proper, or perhaps it was too intense to kind of start off with. Or, there might be something else limiting sort of your ability to exercise. So, for example, one of the things we're very careful to talk to our patients about is with fall risk and things like that, right? So, we don't want people doing exercises where they if they have balance issues that are sort of unsafe, until we either address that, if it's a neurological thing or something, or if it's something where, from a muscular standpoint, maybe there are other muscles that we need to improve before we can get to those more advanced balance or coordination type exercises. So in general, if you're feeling overtired, it's probably too much. And exercise, and if you exercise, you want exercise should not be totally comfortable, right? There should be some feeling of uncomfortableness. That's sort of where the magic happens. That's where your body is sort of improving. But it shouldn't be painful. And people say no pain, no gain. But I would sort of speak against that. I would try to avoid. You don't want to make it painful for you. Uncomfortable is different from painful. You want that sort of good feeling of tension, and you don't want to feel, again, so tired or fatigued that it's causing problems.
Okay. Great, great. Thank you so much for responding to that question. I think that's some good information for those that are listening in today. So Dr. Shashaji's research seemed to have some findings that different ways to incorporate exercise into life with kidney disease and how it could have some significant impact on health outcomes. Bonnie, would you mind sharing with us your experience with exercise as someone with kidney disease? We would love to hear from you.
Okay, yes, thank you. Um, every nephrologist, dialysis nurse, doctor, and physical therapist I've interacted with throughout my kidney care emphasize the importance of staying active and exercise. So I tried hard to follow through with with the advice. Exercising wasn't difficult at first, but became more challenging as my disease progressed. When I was diagnosed with chronic kidney disease in 2012, being active was not a problem. In early 2017, I had reached kidney failure. I experienced a few symptoms caused by kidney failure, but it did not stop me from being active. Um, to slow the decline of my renal function, my nephrologist placed me on a restrictive renal diet and instructed me to lift weights to build upper body strength. Interesting, my OBGYN also recommended weightlifting to slow the progression of osteoporosis. At that time, I used 3 pound weights and continued to walk, and I did easy hiking for cardio health. 3 years later, I was at end stage disease. On July 2020, I started peritoneal dialysis at home, which changed my life radically. I was never able to do PT dialysis like most, through the night like most patients because of drain pain and the loud PD cycler kept me awake. So I connected to the cycler from 4 to 11:30 at night and tried to sleep afterwards. On an average day, I was pretty tired by 3 in the afternoon. My dialysis clinic gave me iron once a month. I did not like feeling fatigued and weak, so I pressed on with my daily activities and exercise regimen. I slowed down to not exert myself. In the late summer of 2021, I began the evaluation process to qualify for a kidney transplant at UCSF. In October 2021, because I was a dialysis patient, UCSF ordered an angiogram. The cardiologist found a 60% blocked artery that required a stent. To recover, I had to pull back from exercise for 5 weeks, especially no lifting heavy objects. I walked short distances at a slow pace. My complete red blood count results fell below standard. Besides receiving iron once a month, I needed Epogen, or otherwise known as Procrit, for anemia every other week at the dialysis center. In the midst of all that, I did receive good news from UCSF. I qualified for a kidney transplant, and my daughter qualified to be my donor. After 5 weeks of very little exercise, I could not believe how weak I had become. What was pressing on my mind was regaining my strength to be ready for a kidney transplant 4 months away. I resumed walking at least 2 miles and switched to using one 2 pound weight rather than two weights simultaneously. In the winter of 2022, I was invited by Dr. Jeshadri to participate in a pilot strength building exercise program for pre-transplant patients. I was very pleased to participate because I needed to be strong for transplant surgery and recovery. I worked with Gabe Garcia, a nephrology researcher, and Jessica Elia, a physical therapist, who personalized my exercise program. I was given a pre assessment to determine the level to begin my program. Gabe equipped me with a Fitbit to count my steps and 3 stretch bands of different resistances. Uh, Through online videos emailed to me weekly, um, Jessica Elia showed me the correct way to breathe, correct posture, tips to prevent injury, warm up, and she set my goals for each of the 5 to 7 exercises. The online videos came with a 3-day log for me to track the number of repetitions per exercise and to leave comments. I was to do the strength building exercises 3 times per week, and I counted my steps every day. I was not very strong at the start and had difficulty with balance. So I worked at a slow pace and did fewer repetitions per exercise. Gabe called me on Fridays to go over my results, and then he would share my results with Jessica. Um, Jessica made adjustments to my program as we went. Into the third week, my strength and endurance noticeably improved thanks to the consistent regimen and being held accountable. At the end of my 6 weeks with the pilot program, I could walk or march 10,000 steps and met the goals of most of the exercises, but I still needed to work on balance. Um, April 19th, 2022, the day of my kidney transplant at UCSF, finally arrived. My daughters and my surgeries went very smoothly. In recovery, all transplant patients were encouraged to be active the day after surgery by walking laps around the transplant unit floor. Whoever walked 13 laps, which was equivalent to 1 mile, would be rewarded a t shirt on the day of discharge. So, with our walkers and my urine bag, my daughter and I completed a mile and we each earned a t shirt. Um, Post transplant recovery did not go well in the first 4 months due to side effects from the medications. I just want to note each person reacts differently to the medications. Um, so 1 week after being discharged from UCSF hospital, my reaction to the new medications made me so weak that I couldn't even walk a few steps without breathing hard or having to sit down. My hands were shaky. My anemia had worsened and the medications raised my glucose. I was hospitalized for 3 days. Back at home, knowing I needed to regain strength to recover from surgery and not succumb to the side effects of the medications, I was determined to walk laps around my house, like at the hospital. I started walking or marching at a slow pace, 1 mile for a while, then 2 miles for a while, then 3 miles for a long time, and now I'm up to 5 miles. Uh, since stopping a particular medication last October that caused problems for me, I feel so much stronger and my endurance has improved. I can garden without feeling exhausted. 6 months ago, last October, I was diagnosed with grade 1 breast cancer. I had surgery and radiation therapy. Recovery has been good. I have an additional set of exercises to prevent lymphedema and to strengthen my arms, shoulders, neck, and back of my shoulder. I am on medication that affects bone density. All of this motivates me to keep exercising. Currently, in general, I feel energetic and strong, but my body is still dealing with the side effects from the immunosuppressants and the surgeries, so I cannot afford to slack off on exercise. I continue to do strength building exercises and walk, march, and jog lightly to reach at least 8,000 to 10,000 steps on most days. I make an effort to stay active. Well, that is where I am today. Thank you.
Thank you. Thank you so much, Bonnie, for sharing your story. Hopefully, that was able to provide some inspiration to others as far as exercise is concerned in their kidney disease journey currently. If you're just joining us, welcome to our session on integrating exercise into life with kidney disease. As a reminder, we are taking questions, so please feel free to drop your questions into chat, and we will get to those during our Q&A segment shortly. So, Bonnie, I have a question for you. While on dialysis, did you have to consider the amount of fluids you were consuming after you exercise?
My fluid intake was not an issue. I was not dehydrated, uh, and I did not have edema. However, my nephrologist allowed me to have as much fluid as I needed, around 1.5 liters every day without it causing any problems. I also had a 200 milliliter of PD solution fill in my peritoneal cavity at the end of each PD treatment.
Okay. Thank you. Thank you so much for your response. Before we begin our Q&A talk, I just wanted to remind our audience that you can visit our resource section on Kidney Action Week's website for additional resources related to this topic. But let's go ahead and get into some questions. So first, I have a question for Dr. Shashadri. Why is intradialytic exercise not common in dialysis centers in the U.S.?
It's a good question. We use intradialytic exercise. It's much more common in Europe and other kind of places. And it does work. And we've done studies of it here as well in the US, which shows that it works. And this can vary, intradialytic cycling, like it has those little like pedal cycling kind of things you put. That's pretty common. Sometimes just upper arm or resistance exercises. But I think that there are a number of reasons for that. I think one big reason, at least when we've been talking about instituting studies of intradialytic exercise, is that there's definitely a concern at dialysis centers for what might be the sort of like adverse outcomes of this. That is, I think for dialysis centers, there is this concern that if you have patients who are exercising to build back up their physical function and maybe they have issues with balance or things like that, the last thing anybody wants is sort of a fall or something like that at the dialysis center. So there's an issue there, both from a patient safety standpoint, and I think also from sort of a liability standpoint, that is more of an issue perhaps in the US than it is in other places. So that's something we've sort of encountered in terms of resistance to incorporating these, unless in certain cases we've been able to sort of lean on the vast body of evidence showing that it's safe and say, hey, I think this is all right. But even then, there's some hesitancy. I think that's a big part of it. And I think also the conversations about physical activity and exercise are just sort of different, both in sort of like daily life in other places in the world compared to the US. That is, it's much more integrated into daily life. There are other places that are more walkable. Activities and things like that are sort of more the norm. Whereas, unfortunately, the way a lot of cities and things are set up in the U.S., walking and getting around, we sort of had this enforced sedentarism, and I think that actually permeates the healthcare system as well to some extent. It just doesn't come up so much in conversation, so it's not part of that background milieu where it's like, oh, of course you must be active and things like that at every sort of level in the health system. So I think there's those two reasons. The bigger one, the biggest, if I had to put one reason, I would say it's a concern for liability. It's probably been an obstacle, at least in my experience.
Okay. Great. Thank you so much for your response to that question. Bonnie, I have a question for you. So it sounds like you had multiple challenges that came up post-transplant. How did you stay motivated throughout that process? And also, have you found an exercise partner that's been helpful during those hard days to keep you motivated as well?
Um, I don't have an exercise partner. I basically do this on my own. Um, as far as challenges post transplant, I felt weak and shaky the first 4 months of post transplant. Just like the hospital had me walking, the day after transplant, I walked every day at home to build strength. I started 1 mile and wasn't concerned about how long it took me to walk that mile. I just needed to do the mile, and it felt good to see 1 mile light up on my Fitbit. As I felt better, I added another mile, and eventually I resumed doing um, a few of the strength building exercises and increased my steps. So I was at 3 miles for a while. Today I could, like I said before, I could go 5 miles, but not every day, a few times a week. And I do the exercises without feeling exhausted.
Great, great. Thank you so much for that. Is there a recommended, is it recommended to continue with exercise regimen as we age, Dr. Shashardri?
Folks get older, that exercise regimen may have to be adjusted. And you might have to, so for example, in terms of sort of physiological reserve, it's always necessary before exercising to make sure you have adequate nutrition, hydration, the right environment, the right temperature, and things like that. So those sort of like base level things become probably more important as you age. But I would say that, in many ways, it's even more important to exercise as you get older. I mean, some of our research even shows if you're talking about, exercise interventions for people with varying levels of physical function, one, everyone tends to improve to the extent that they're able to actually engage and participate. And two, some studies even show that people who have, you know, um, worse baseline physical function might actually gain more from exercise interventions. And these are people who have CKD or even end stage kidney disease. So with that same sort of token in mind, aging is different for everyone, right? And people age. Some people, as you age, okay, let me step back a second and say that, age is not exactly just a number. I mean, age is real. As we age, our bodies change. But at the same time, that number is not the sole arbiter of who you are and what you're able to do. And so people are going to be at the same age at different levels of physical function. And so as long as they're able to find a tailored exercise regimen for them, then I think it's important to continue that exercise because that's the kind of thing that allows for what we call sort of successful or healthy aging. Being able to participate in life to the fullest extent on your terms um, is something that exercise can help you get to that goal.
Great, great. Thank you so much. So just kind of going back into another recommendation that we're looking for, are there different recommendations that you have for someone who's on peritoneal dialysis versus hemodialysis in center? Dr. Shashardri, that's for you.
So I would say that the same general exercises would actually be beneficial for both. With hemodialysis, one thing to be well, the only real difference is in terms of the exercises that you are able to do, I'd say, is to make sure you're not doing any exercises that impinge on your access. So your peritoneal dialysis catheter for PD, your
Mhm.
fistula, or potentially your tunnel dialysis catheter if you're a patient treated with hemodialysis. But in general, the same goals are there in terms of improving sort of core body function, lower extremity. You could argue that core exercises might be more important for patients treated with peritoneal dialysis, again, so long as they're not disrupting the catheter. But at least the surgeons that we've spoken to in designing our exercise studies in general say that that's not an issue, that they're able to do, abs and, ab workouts, planks and things like that without the catheter being an issue. But I would say I would not necessarily differentiate based on dialysis modality, but more based on the patient's initial sort of, do they have any range of motion deficits? Do they have any issues with balance? Do they have neuropathy? What's their current, level of strength? Those are the things more than the dialysis modality itself that probably determine what direction you go when you're first starting to exercise or as you progress.
Gotcha. Great. I guess this question could be for both of you. Are there certain recommendations you would make for someone who's looking to find some motivation for exercise? So, is there an app that they can use? Is there, a tracker, writing things down, journaling? Like, what are some suggestions to kind of get people up and moving and helping them remain encouraged?
Bonnie,
I
do you
guess
start
we
with this
could,
one?
yeah, let's
Yeah,
start with Bobby.
I can share what I do. I use a steps tracker every day. I wake up and I put it on. It's right here. And I, have it on all day long so I can track my steps. And by towards the end of the day, if I notice I haven't reached a goal that I've set for myself, then I just start walking around my house. I do laps around my house. Um, and as far as motivation is concerned, I want to feel well. I want to have energy to live an active life. And I don't want, like I said before, I don't want to succumb to the side effects of the medications. And I have, you know, this kidney transplant and breast cancer that I'm dealing with. So this is really crucial for me. It makes a difference in my life.
Thank you.
And I guess I'll add to that by saying, having progress checks like a step tracker, exercise log are very helpful because one, I mean, you have this on paper, like this is what I did, right, and that helps you sort of take that next step forward. But you can also track your progress over time, which I think for some folks, for me actually personally, it's very helpful to kind of see, as I achieve like a personal record on the bike or something like that, like where I now versus where I was before. And I'll say that that number fluctuates, right? It definitely drops with time. Like the whole family got sick last winter. There wasn't a lot of exercising going on for a little while, and those numbers definitely dropped. But knowing that I at one point was at this better peak gave me motivation to sort of like build back up to that goal. And I think it's also one thing that I think is important to do is build into sort of like what is important to you sort of in life. So a lot of our patients would say, I want to go walking with my family again on hikes, or I used to be able to do this bike ride down this hill, and now I can't. I want to be able to do that again. Like find those sort of like nuggets of joy, those things that physical ability sort of helped you to kind of do, and that's a good goal to sort of like work towards. And it's always good to take sort of this mental inventory of yourself and see like, okay, why am I doing this? Where am I right now? How are my actions currently going to help me move forward towards that goal? Which I guess is good for really any step in life, but in exercise, really keeping that in mind can really help you get the motivation, even when you're like tired or something like that. And I'll say that on those days, it's okay to have a day where you don't go all out, right? There might be days where you exercise or are less active than you are on other days, and that's fine because any step there is a step in the right direction, right? All of that progress counts.
Awesome, great. It looks like we have another question that is coming in right now. Okay, great. Can exercise slow the progression of CKD to prevent dialysis? And Dr. Shashardri, I'll pass that off to you.
So, so we actually just did this that analysis, which I sort of briefly alluded to earlier in the talk, and it does look like exercise can delay progression of chronic kidney disease, which is very cool because again, we don't have that many tools in our arsenal. They tend to be pharmacological tools, Um, but the number is basically over 2 years for patients in this exercise study. It was about between 1 to 2 sort of like it prevented between 1 to 2 sort of points in decline per year for these patients. Um, but that can potentially, I mean, that adds up, right? That adds up earlier in life, and even if you're somebody who is approaching dialysis, it can sort of add up. Now, as I will say that the study was primarily people who were sort of in stage 2 and 3 of kidney disease. The study is limited by not having so many people with advanced kidney disease. But even outside of the context of these randomized controlled trials, which is sort of our gold standard of evidence, there is sort of a plethora less strong evidence, but still all evidence suggesting in that right direction that physical activity is associated either with better kidney function or slower decline in kidney function. Um, and I'll say one of the things we're hopefully coming to a journal somewhere near you soon is that there's mechanisms within the kidney, anti-inflammatory mechanisms, things like that, that exercise tubular health mechanisms that exercise seems to impact sort of on the fundamental biomechanical way that's separate from the overall cardiovascular and blood pressure and weight-based goals. So broadly speaking, yes.
Thank you so much for answering that question for us.
Sure, I might have been a little
So
in the weeds.
you did just fine. So, before we end today's session, because we're coming up on our time here, you both kind of gave us some great points to share about motivation for folks out there. I love the one about, just making sure you're keeping track or you're setting that goal. But if you could, please provide us with, one thing you want folks who are here today to know, or, something that they can do regarding kidney disease and exercise. So if both of you could just provide something like that for us, I will start with Bonnie.
Mhm. Um, my main concern for me was to stay strong, to stay healthy. And so I don't get sick and I have no resistance to fight the sickness. I am getting older, I'm not a young person anymore. So I have to watch my health even more carefully. And I don't want my family and my friends to worry about me being sick, or having a transplant and I'm not well. So, yeah, that motivates me. It's just to stay healthy and be active.
Great. Thank you. Dr. Shashadri, any final thoughts?
Yeah, I mean, I'd say that exercise. It's not just a one-time thing, right? I mean, like, and it can be, but ideally it's not. But ideally, you find a way, whether through finding your own sort of like personal motivation or just incorporating it into your daily life, where you can really make it a sort of lifestyle. And I don't mean like you have to be doing like P90X and CrossFit or like an ultra marathon. That is a lifestyle too, yes. But just incorporating these ways to be active and these structured sort of like bits of exercise in your life, and it doesn't have to be in a way that's sort of intrusive, but the more that you sort of it becomes sort of a habit, so the more that it sort of becomes something that is just part of who you are, the more it not only starts to feel sort of like natural, but you can sort of, I think that really helps you uh, to look back and see like how your body sort of interacts with the world and how doing this exercise helps you participate more in life. So whatever that means for you, life participation, wherever is your activity, whether it be dancing or whether it be just being with your family, or whether it's just as Bonnie said, making sure that people don't worry about you, that they can engage with you as sort of as a person rather than worrying about the disease and the other things. Like
Mhm.
those are all perfectly valid motivations and all very good reasons to stay active and to keep exercising. So find what works for you, because that's the best medicine is the one you take, right? At the end of the day, what you find enjoyable, what you're able to engage with, and what you're able to progress with, that's the right path for you.
Great. That was a great final note to provide our audience today. Dr. Shashadri and Bonnie, I would like to thank you for joining us and for sharing such great information with our audience. Also, thank you to our audience for tuning in today for our exercise session. Up next, we have some live interactive cooking classes that are happening at 6 p.m. This is a separate registration, so those who signed up, please be sure to check out your email for your link. For those who aren't joining us for tonight, we hope to see you tomorrow at 2:15 Eastern Time for our congressional briefing and a few other great sessions that we have in store. If you missed a session from today or any previous days of Kidney Action Week, check out our website. You can see it on our Kidney Action Week platform, or you can also go to YouTube as well. Once we conclude the session, you'll see a poll for a quick survey pop up. Please take a few minutes to fill it out and tell us how we did. Your feedback is very useful as we plan future sessions. Thank you, everyone, for joining us today, and have a great day.